Good morning, everyone. Welcome to another online webinar from the National Institute for Occupational Health in collaboration with the National Economic Development and Labour Council, NEDLAC, supported by the Compensation Fund as part of the Department of Employment and Labour. Today's topic is dealing with COVID-19 control measures and the current practices, what the lessons are that we've learned from the last 2 to 3 years. And we've got a distinguished panel that will be joining us today, and that's Ms. Jeanette Mangani, the head of our occupational hygiene section in NIH, Ms. Karen Dupree, an occupational hygienist in the occupational hygiene section as well, and Mr. Gabriel Mizan, who's also an occupational hygienist in the occupational hygiene section of the NIH. And we are now going to play our pre-recorded webinar, and I'm going to ask my colleague Tabani to proceed with that in a moment. A quick reminder to all of our attendees, please use the question and answer box to type your questions so that the speakers and the non-speaking panelists can answer your questions in the question and answer box. And for that, I thank you. And I hand over to my colleague Tabani to just start the pre-recorded video. Thanks. So thank you everybody for joining us this morning on the National Institute for Occupational Health's webinar again. And as I mentioned earlier, it is the panel discussion on the COVID-19 control measures and current practices. And our guest, our panelist today is Jeanette Mangani, the head of our occupational hygiene section here at the NIH. And we have Ms. Karen Dupree. She is the occupational hygienist in the occupational hygiene section, and also active in the professional bodies of the hygiene sector. And then Gabriel Mizan, who's the occupational hygienist specializing in asbestos investigations here at the NIH. So welcome everybody. Good morning.
Good morning.
Okay, so let's start with the first question. Jeanette, I'm going to direct that to you. Where do control measures fit into the risk assessment management process?
Thank you very much, Ashraf, for the introduction, and good morning to everyone. It is such an honor for me to be part of this discussion. So to try to answer your question, Ashraf, control measures form part of an ongoing risk management process, which is made up of 5 pillars, some I can say maybe 5 steps, starting with identifying hazards, then it's followed by assessing the health risks. After that, and then you start to identify the control measures which are suitable to the situation that is being assessed. Then the employer is recommended to implement those control measures. And then the process continues where you monitor and review the process. So in other words, as you do the risk assessment, whether qualitatively or quantitatively, so suitable control measures should be identified and get implemented. So maybe just to remind our audience that quality health risk assessment was presented in the last webinar, where we covered a risk assessment tool and a risk assessment matrix, where the hazards they were identified and also the risks were classified according to high and low or medium. So, but when we talk about quantitative risk assessment, is often referred as surveys or monitoring, where also control measures are relevant. That is another way of assessing the risk, the health risks, where you involve measurements, and then the results are obtained where you compare with the legal limits or maybe guidance values to establish whether there's accidents or compliance or conformance. Thanks, Asha.
Well, thanks. Let me follow up that. So what professional rationale is used in recommending controls?
Okay, great question, because it is not advisable that control measures should be generalized. So control measures should be practical and specific to the situation. They should be recommended having a hierarchy of control measures in mind, which is the method that it lists the control measures according to their effectiveness. So you find that control measures that are listed at the top of the hierarchy, usually they are potentially more protective and effective than measures which are lower on the hierarchy. For example, if you like to control the hazard at the source of generation, you may require high-level controls, such as elimination, substitution, and ventilation or engineering. Yeah. Similarly, if control of exposure is required along the path, where it sort of left the point of generation, but halfway before it reaches the worker. So control option like engineering is often advisable, such as an enclosure where you sort of create a barrier between a person and a hazard. However, when the hazard reaches the employee or the worker, then you find now that you have to introduce control measures such as administrative. So typical examples would be like following the SOPs, training workers on how to use personal protective equipment. Sometimes you can also introduce staff rotation. So, but the challenge with this kind of control is because they require a buy-in from employees and cooperation. And the fact that the hazard still exists, it's still there in the workplace. So another thing to also keep in mind is some of the situation in a workplace may require more than one control options, while others may require a combination of high effective and less effective controls. Thanks, Sasha.
Well, thank you very much. It was quite detailed. So it's the mixture of those controls that are important. So let me just ask you a question before I move to Karen. Another question: what control measures would you be covering in this webinar as a team, as a hygiene team?
Okay, thanks for this question, Ashraf. I mean, control measures are a broad concept that cannot be covered in a single section, especially one of this kind. So I'm hoping I was able to give a background on background information about control measures in general. Karen will be discussing some of the fundamental COVID-19 control measures that are still relevant today and may still be used in any workplace situation. In addition, Gaby is going to be discussing some basic ventilation principles. Thanks, Sasha.
Well, thank you very much. That was Jeanette Mangani, the head of the occupational hygiene section. I'm going to move to a colleague, Karen Dupree. Karen, during the COVID-19, and we're focusing specifically on what we've learned during the last 2 to 3 years with dealing with a biological hazard in particular. So during the COVID-19 pandemic, there were many regulations and directions applicable to the workplace, and we needed to follow, obviously. Did all of it fall away since then?
Thanks for that, Ashraf. The regulations and the directions that was published at that time under the Disaster Management Act all ceased to have any legal effect when the declaration of the National State of Disaster expired in April, on the 4th of April 2022. But the revised hazardous biological agents regulations that was promulgated on the 16th of March in 2022 included the SARS-CoV-2 virus as a Group 3 hazardous biological agent. So this then places a legal responsibility on employers to implement measures to limit exposure and to mitigate the risk of infection. The Department of Employment and Labour also published the Code of Practice, specifically on managing exposure to SARS-CoV-2 in the workplace, and that came into effect on the day when the National State of Disaster expired on the 4th of April 2022. And the purpose of this code was to provide, in general, guidance to employers and employees to continue managing exposure to SARS-CoV-2 together with any other hazardous biological agent in the workplace, to assess the risks to health in the workplace, and to implement suitable control measures to mitigate those risks. So the answer is yes, we still have valid regulations and directions to ensure that the risk of exposure to any of the hazardous biological agents in the workplace, and then which includes now SARS-CoV-2, are identified and addressed appropriately.
Well, thanks, Karen. Just a reminder to you as our audience, we've done webinars on the hazardous biological agents before, and the regulations were covered thoroughly in one of those, as well as the Code of Good Practice. So please visit our website and go and view those videos again on our YouTube channel. So Karen, do employers currently still have any duties or responsibilities with regard to COVID-19?
Most definitely, Ashraf. The Occupational Health and Safety Act requires employers to provide and maintain, as far as reasonably practicable, a working environment that is safe and without any risk to the health of their employees. And then to take the necessary steps to limit or mitigate any hazard or potential hazard. But it also requires that employers don't only look at the employees as such, but also their clients, the public, or any contractors and their workers that might enter their workplace or coming into contact with their employees. So employers definitely still have a duty to determine the risk of exposure to any hazardous biological agent, including SARS-CoV-2, and the control measures necessary to limit infection or transmission, and to make sure that the workplace for everybody entering it remains safe and without risk to their health.
And I would assume, Karen, that it also apply to the employer, ensuring that the occupational medicine and occupational health nursing practitioners also play a key role in terms of the services they provide with regard to obviously keeping people healthy and safe.
Absolutely.
Okay. Well, thanks. So just another question for you, Karen, if I could just quickly get there. So how we know which measures are applicable to our specific work environment?
Ashraf, as Jeanette also mentioned, the starting point will always be to conduct a risk assessment in your specific workplace, where you can identify any hazard. In this case, we're talking about the hazardous biological agents now, but obviously it includes all the other risks that may be present in a workplace. And to assess the risk it may pose to the health of employees, to customers, or members of the public. The employer must then identify any measures that is suitable in that specific circumstances to protect the health of employees, customers, members of the public, but also it must happen in consultation with a trade union representing the employees, or at least the health and safety committee established for that workplace. And any measures that's implemented or any of these discussions, all of the decisions taken need to be communicated to the employees. And this can usually be done through policies, procedures, the general communication lines used in the organization. Each situation, as Jeanette also mentioned, may require special measures to be implemented in order to prevent infection or transmission. So it's definitely not a one-size-fits-all. Every workplace will have its own specific measures that's applicable to that. And even within a workplace, different tasks can have additional measures required for those specific tasks. And these measures can then include requirements, anything with regard to the reporting of symptoms, vaccination where applicable, personal protective equipment, ventilation, and depending on the risks that's identified and the specific situation, it can also address still social distancing measures or personal hygiene measures, such as the wearing of a face cloth mask, using of barriers, hand washing. So depending on the risk, any of these measures might still be applicable in specific workplaces.
Well, I must admit that my personal hygiene has improved when all those measures became regular and daily things. So, Karen, just one more question. Which practices implemented during the pandemic should we incorporate in our everyday work environment? This is not Ashraf's personal hygiene routine, but in the work environment. What are those sort of practices that we should be incorporating in the everyday work environment?
Ashraf, there's a well-known health and safety principle that was really highlighted during the pandemic, and that is that all of us should be responsible for our own health and safety, and also for the health and safety of our colleagues and people around us. Employees should always follow the internal organizational policies and procedures as applicable in their specific workplace. General things like when we are feeling ill, we should act in a responsible manner to ensure that we do not put others at risk of being infected. Some of the measures that we can implement can include still wearing of a mask in a situation. If I'm coughing or sneezing or not, in a situation in this room, it would be advisable for me to still wear a mask. If I'm sick, go seek medical attention, and if the doctor advises, stay at home. Basic things that was really just highlighted now. It may also include keeping a reasonable distance from colleagues or members of the public, as this may lower the risk of transmission of a virus to anyone else, of any infection. We also learned that the basic precautionary measures, as you mentioned, on personal hygiene, like regular washing of our hands and still using hand sanitizer or surface cleaner where it's possible to do so, can really play an important protective role.
Excellent. Thank you very much for that. That was Karen Dupley, our occupational hygienist here at the NIH. So over to Gabriel Mizan. Gabriel, on this question of ventilation, which we want to focus on at the moment, ventilation assessment, apologies. The first question is for me is, how important is ventilation in protecting against infection from hazardous biological agents, for example, COVID-19? Gabriel?
So Ashraf, when we talk about hazardous biological agents, probably the most important measure is ventilation and adequate ventilation. Okay, so I say adequate because inadequate ventilation can actually increase the risk. And there were a few studies that were done during the COVID pandemic that actually show that inadequate ventilation increased the rate of infection. And I think we all know about the famous study that was done in China, in one of the restaurants where the air conditioner was circulating air in that restaurant, and there was one sick patient there. And because of the circulation of air, many other diners in that restaurant actually also got infected and got sick. So adequate ventilation is very, very essential in controlling infection to hazardous biological agents.
Okay, thanks for that. So what is adequate ventilation? I think you've raised an important point that inadequate ventilation is a problem. What is adequate ventilation then?
Okay, so the key word here is fresh air. So adequate ventilation, or ventilation in a broad sense, is really introducing fresh or clean air into a space or a work environment. And I say clean or fresh or clean air because the fresh air, what we talk about, fresh air is not always so clean. In other words, the outdoor air can also be contaminated. So introducing clean air, uncontaminated air into the work environment is really the key of ventilation, of adequate ventilation. Of course, the question comes on how much fresh air needs to be introduced, and this is taking us back to the health risk assessment that we mentioned before. So we need to see what is the actual contaminant, what is the risk of exposure to that particular substance, and that applies both to chemical and biological agents. So what is the risk of infection? Who is at risk? Are we talking about a healthy worker or a vulnerable employee, or whatever the case might be. We need to look at what activities are happening in that particular environment. We need to look at the space itself. How big is the area that we want to ventilate? So there are different elements that are going into this equation. It's not a simple answer, but there are guidelines for that.
And so it's important for people to know what those guidelines are and to follow those.
Absolutely.
Okay.
So one of the parameters that we often talk about in terms of ventilation is air changes per hour.
Right.
Okay, so air changes per hour is basically what it means is how many times in an hour the whole volume of air in a space get replaced or changed by fresh air or by clean air. Okay, we don't want to replace the air with contaminated air. So air changes per hour is one important concept that we're talking about, and there are again different guidelines about that. For example, I've recently seen a recommendation from the CDC. They spoke about a minimum of 5 air changes per hour. Obviously, if we're talking about an environment like a healthcare facility, we might want to increase the number of air changes per hour. The ASHRAE, which is an American body for air conditioning and ventilation, speaks about 12 air changes per hour for a specific healthcare facilities. Another important guideline, another important parameter that we speak about when we want to take into consideration the number of people that are in a work environment is the liters of fresh air per person per second. So that's another parameter that is getting often quoted. For example, one of the WHO guidelines speaks about 10 liters per second per person to control infections.
So that's one key criteria for adequate ventilation, the air changes per hour.
Yes.
Is there another one linked to content of the air?
So there are others. For example, another important parameter is the carbon dioxide levels. As we all know, carbon dioxide is a waste product that's emitted from respiration. So we emit carbon dioxide in a space. So high levels of carbon dioxide indicate poor ventilation, poor fresh air supply into the space. So the lower we can get those carbon dioxide level, the better the ventilation is. Again, there are different guidelines. There is a European guideline that speaks about we want to have below 550 ppm, parts per million, of carbon dioxide levels in a general building. The ASHRAE that I've mentioned before speaks about the difference between the indoor and outdoor level of carbon dioxide, and they recommend that this difference shouldn't be more than 400 ppm. In other words, we shouldn't have indoor a concentration of carbon dioxide that is 400 ppm and more than the outside environment. That's another indication of how fresh or clean the air in a space is.
So quick clarification, ppm, parts per million.
Parts per million.
Thank you. The next question is, how can we improve the quality of ventilation in any space, especially workspaces?
So the most obvious way to do that, and it's amazing how many times people actually don't pay attention to it, is to open windows. By opening window, it's a quick, cost-effective, easy way to introduce fresh air into a space. It's not always practicable, I've been to some areas like laboratories where they say we're not allowed to open windows, or because of weather conditions that you can't open windows because it's too cold or too hot or whatever. then the next best way is to obviously install mechanical ventilation with fresh air supply, of course, not just circulating air in a space. So these are basically the ways that you have to improve air ventilation in a space.
Well, thanks for that, Gabriel. That's Gabriel Mizan. And in closing, so if I could return to you, Jeanette Mangani, what's your take-home message for our audience? I mean, we're dealing with a very important aspect of control measures and how that's supposed to assist us in the workplaces. What's your take-home message for us?
In summary, Ashraf, I would like to say that if you want to ensure that meaningful control measures are recommended, a proper risk assessment should be conducted. And it doesn't end there. You know, we don't want the report sitting there being shelved. Employers should play their own role. They should have an action plan that attempts to implement those effective control that I spoke about as a priority. And by doing that, it will help them strengthen their risk management process and fulfill its intended purpose of safeguarding the health and safety of employees. Thank you.
Well, thank you. That was concise and brief. Thank you. We have about 2 minutes left. Karen, if I could come to you and ask you, what's that key message that you want to leave with our audience before we close the webinar?
Thanks, Ashraf. I think the COVID-19 pandemic really highlighted the impact of hazardous biological agents in the work environment, and it introduced us to some basic measures to guard against infection. Many of the lessons that we learned during that time are still relevant, and I think we should learn from it, and we must really follow it, because that can contribute to a safer and a healthier workplace.
Thank you very much. Incorporate those lessons we've learned is the key message from Karen. Gabriel, from you, what's your take-home message? We have about 2 minutes, just under 2 minutes left on this. Go ahead.
Okay, so obviously, from what we've said, you know, the risk assessment is the basic, but in terms of the ventilation, I would say fresh air is really key, and ventilation is really adequate ventilation is really very important to control exposure to anything that is in the air, being it biological agents or chemical agents. And also don't forget to look after your ventilation system, because it's not enough to install a system that 1 year or 2 years later is not working. You know, so looking after, maintaining, replacing your filters, doing whatever needs to be done, monitoring the quality of the air to make sure that your system is working as it should.
Well, thank you very much for that. That's Jeanette Mangani, Karen Dupree, and Gabriel Mizan, our panel today. And you've heard the message. And I think the final sort of point that Gabriel has made is clean, fresh air is important, and ventilation of different kinds as appropriate for your workplace to minimize or eliminate those exposure to hazardous biological agents. So at this point, I want to say thank you very much to you, Jeanette Mangani, for your contributions as the head of the occupational hygiene section here at the NIH. Karen Dupree, thank you very much for your contributions. And finally, Gabriel Mizan, thank you very much for your contributions. And with those key messages, critically, it's our job now, back in the workplace, all of those who are responsible and have functions and contributions to make with regard to making our workplaces healthier and safer, you've now got the key messages, and we'll have the presentations and video after the session for us to review. Thank you for joining us today. Goodbye.
Thank you, everybody, for joining us. We are about to close. Just one point that I need to mention is that Gabriel Mizan has indicated that the guideline for the above 400 parts per million ppm difference between indoor and outdoor carbon dioxide levels is from the EN 16798 provision, the international provision. With that, thank you very much. We close today's webinar and we look forward to seeing you in the next webinar. Goodbye.